As Speaker of the Northern Ireland Assembly, I'm delighted to officially welcome you all to the Assembly chamber for today's Women's Parliament. My predecessors and I have used our ability to grant the privilege of using this chamber to facilitate a number of outreach parliaments to provide a platform for specific sections of our community to come and make their voices heard to members and indeed to ministers. So today I'm delighted to be able to chair this important debate to enable key issues and concerns that impact and affect women across Northern Ireland to be expressed. Of the 90 seats in the Assembly, 36 are held by females, 40%, which is a significant increase from when I joined the Assembly, where frankly there was only a smattering of women in the chamber. Within the Executive, 7 of the 12 ministers are female, including our First and Deputy First Minister, as well as the 2 junior ministers in the Executive Office, who I'm pleased are with us today. It's a sign of how important this occasion is that alongside the junior ministers, both the Health Minister and Minister for Agriculture, Environment and Rural Affairs will be responding to issues raised during today's proceedings. The Northern Ireland Assembly Women's Caucus is a cross-party forum made up of all current women MLAs. I know many of you have had the opportunity to meet with them earlier and discuss today's issues and solutions, and I hope that perhaps your experience today and the example of the members of the Women's Caucus might encourage some of you to consider entering the world of politics and public life. I trust that your contributions today will highlight issues that are impacting women across Northern Ireland, and you'll demonstrate how you want to see the Executive address them. Before we move to the formal proceedings, I'd like to invite Elaine Crowley to briefly set out the background to this Parliament.
Thank you, Mr. Speaker. Thank you also to the Assembly Engagement team who've worked so hard over several months to make sure that this Women's Parliament could happen. Thank you to the hundreds of women who responded to the survey and outlined their priority issues, many of whom are watching today either at home or in the public gallery. We won't be able to cover every issue you care about because there's just not enough time, but we will do our level best. Thank you to the MLAs and ministers who regularly raise the issues that we'll be speaking about and who engage with our organisations that are on the front lines working on these issues every day and who take our concerns seriously. And finally, thank you to the other organisations that were part of the design process for today and who've nominated me to do this speech, and I hope I do you justice. Today, we'll be hearing about lived experience alongside facts, figures and statistics. I've worked closely with some of the women who will be speaking today, and there was not one who struggled to fill her allotted time. Rather, they all had more to say than they had time to say it. Even within the confines of the 9 topics chosen, if time was not an obstacle, we could be here for a full day. Those of us who work in this area tend to wear several hats all at once. We may enter a room, for example, with the remit to talk about women's economic inequality, but we know that you cannot do that topic justice without speaking about childcare or caring responsibilities for older or sick family members. And if we go into a room to talk about pay gaps, we know that this issue is connected with the undervaluing of the kinds of work that women tend to do, and we know that that's rooted in gender stereotypes. The same stereotypes play into the long delays that women face for health diagnoses or for a lack of support when some women are experiencing crisis in their physical or their mental health. Meanwhile, economic inequality and gender stereotypes come together to help create the situations for abusive relationships, and they trap women in those relationships. Poverty is gendered too. It's especially difficult to escape poverty in a world that penalises women and undervalues us. The connections go on and on and on. If you pull on a thread, everything unravels. It's all connected. We know too that the more marginalised a woman is by other factors in her life, the harder it'll be for her to overcome those barriers. If childcare is inaccessible in an urban area, it's way worse in rural areas, not to mention the access to public transport, to reach employment and other things that rural women face. If women are not taken seriously by medical professionals when they appear otherwise healthy, it's worse again when they are older women, LGBTQ+ women, disabled women, or women of a different ethnic background. Our lives are complicated. There is no such thing as one single totemic woman. As Audre Lorde said, there is no such thing as a single-issue struggle because we do not live single-issue lives. However, I think everyone will be pleased to hear that we women are resourceful. We don't just come here today to complain, but also to propose solutions. And those solutions, like the ones that we assembled in our Feminist Recovery Plan that we launched in 2021 and that formed the topic of our most recent Women's Parliament in 2022, those solutions are intersectional and they're practical. In the same way that the problems are interconnected, the good news is that the solutions are too. The programme for government is the ideal place to see these priorities and our proposed solutions embedded. In addition, by including targets and measurable outcomes, we'll be able to see what kind of progress we're making. For too long, progress has meant one step forward and two steps back, and that has to end. Today, this Parliament will hear contributions from women of many different backgrounds, ages, types of experience. And we've all been sent here to cover individual topics. But what we want, however, is to be heard as a choir. Thank you, Mr. Speaker.
Thank you. Order. I call on the clerk to read the motion.
That this Women's Parliament awaits the publication of the programme for government, recognises the progress made and the work still to be done in a number of areas, such as ending violence against women and girls, improving access to healthcare services for women, delivering affordable childcare and the impact on rural women, calls on the First Minister and Deputy First Minister, working with the executive colleagues, to embed gender equality as identified in this Women's Parliament in all aspects of the programme for government, and further calls for the development and delivery of affirmative, measurable actions that will ultimately deliver gender equality for all.
I call on Edel Gribben.
Thank you, Mr. Speaker. My name is Edel Gribben and I'm a member of the Northern Ireland Rural Women's Network. I'm here today to speak on some of the issues that affect rural women. But while many of the issues being raised here today are indeed rural issues, it would be impossible for me to mention everything that affects rural women acutely. I would, however, like to give an honourable mention to the rural women who continue to experience the cost of living crisis, the increase in women relying on food banks, the women affected by the closure of essential services at many rural hospitals, and the many thousands of rural women who are socially isolated within their communities. Social isolation is now at crisis levels, and during COVID-19 we all experienced it, but for many in rural communities, isolation is still an everyday reality.
Will the member give way, please?
Yes.
Thank you, Mr. Speaker. My name is Barbara Campbell. For any of you who have spent time with older women, you may have heard the saying, "Not in my day." A wistful reflection of days gone by when communities supported each other, GPs responded in times of crises, and communities wrapped themselves around those in need. More recently, I've heard it over and over again from vulnerable older women in rural settings, where added disadvantage is experienced due to lack of health and social care preventative services and community-based support, which are evident in rural areas. The impact of living without support is reflected in rural women experiencing physical deterioration, loneliness and isolation, contributing to mental and physical decline and sometimes exhaustion because they care for older or disabled relatives. To those of you in leadership positions, this is your day to change the neglect of our older generation. When it comes your turn to be in that vulnerable position, what might you say to the younger generation about how you led this context? I hope it is neglect of older rural women, not on my watch, not in my day. Their time is short. Thank you.
Thank you, Barbara. Digital poverty, the centralisation of key services and a lack of digital literacy are affecting our rural residents, particularly older women, who face challenges navigating online platforms. The shift to digital for essential tasks like booking hospital appointments and managing finances has become an even difficult task, particularly with the closure of many bank branches rurally. The shortage in flexible, affordable childcare is a direct impact on rural women's ability to work, pursue education and engage in their communities. Many rural women are forced to reduce their working hours, take lower paid jobs or even leave employment altogether. and this isolating experience is only adding stress to the caregiver's mental health and well-being.
Will the member give way?
Yes.
Thank you, Adele. Thank you, Mr. Speaker. My name is Denise Kelso. Being a mother of young children is challenging, but in rural Northern Ireland it is even harder. Vital services like healthcare, childcare and parental support are often miles away, leaving mothers isolated and struggling. Imagine needing urgent medical treatment for your child but facing long travel times just to see a doctor. Imagine wanting to return to work but having no affordable childcare options nearby. Imagine feeling completely alone because there are no local support groups, and can only just imagine dealing with these issues and having no reliable or affordable public transport system. This is the reality for too many rural mothers. Sure Start is a vital lifeline for many families with young children, but only covers 25% of Northern Ireland families. It is concerning that the Healthy Child, Healthy Future, Healthy Review statistics for Northern Ireland 2023-24 failed to mention rural once in its report. Every mother deserves access to the services she needs to care for her children and herself. We call on this executive to invest in rural healthcare, flexible and affordable childcare, community support and accessible and reliable public transport, because no mother should feel forgotten simply because of where she lives.
Thank you, Janice. Mr. Speaker, the current one-size-fits-all approach to our mental health care system doesn't work in rural communities. Finding support during a mental health crisis should not mean waiting for months for an appointment or travelling for hours for care. The centralisation of specialist services without the supporting infrastructure will continue to limit rural access, and lengthy travel times will remain a barrier to women accessing the support they need. Women in rural areas deserve the same level of access and responsiveness as those in urban centres. Now, these issues have been raised time and again, yet the balance in resource distribution has not improved since the previous Women's Parliament. Less than 2% of all funding for women's initiatives go to rural women, despite 40% of the population living in rural areas. Now, rural communities are filled with women who want to thrive and not just survive. It's time they receive the funding and support they deserve. Every single minister in this executive has a responsibility to deliver for rural women. The solutions are clear, and we call for action and commitment from the executive to restructure the mental health care system, to prioritise social prescribing to combat loneliness, and to improve the well-being of our rural communities. Thank you, Mr. Speaker.
Thank you. I call on the Minister of Agriculture, Environment and Rural Affairs to respond.
Thank you, Mr. Speaker. I am delighted to be able to attend this Women's Parliament today. It's a much bigger turnout than in usual sessions of the Northern Ireland Assembly. And I'm also pleased to be able to have attended the roundtable discussion and the lunch which preceded this. I know that Minister Nesbitt and Junior Ministers Riley and Cameron will also be replying to today's motion and to the issues which will be raised by speakers later today, but I'm grateful for the opportunity to hear about some of the particular issues which face women who live in rural areas and to speak about the steps my department has taken to address those. I'd also like to thank the previous speakers for highlighting some of these issues in their contributions. Although the Department of Agriculture, Environment and Rural Affairs has always played a lead role as a champion for rural communities, the reality is that all departments have functions which cover both urban and rural areas. Under Section 1 of the Rural Needs Act 2016, all departments must have due regard to the needs of people in rural areas when developing policy and delivering public services. My department will continue to work with other departments to help to ensure the needs of rural communities are addressed. My department continues to develop and implement a series of initiatives through the Tackling Rural Poverty and Social Isolation Framework, the acronym for that is TRIPSI, which aims to address poverty and social isolation in rural areas. The framework encourages effective partnership working with other statutory organisations and the rural community sector, and my officials continue to work closely with the Department for Communities, Infrastructure, Health, Public Health Agency and local councils to develop and deliver initiatives which continue to contribute to addressing rural isolation, loneliness and health and wellbeing issues. The TRIPSI framework focuses on 3 priority areas for intervention: access poverty, financial poverty and social isolation, and aims to support measures designed to address these priorities in rural communities. Under the TRIPSI framework, an annual TRIPSI action plan is developed and delivered each year, setting out proposed initiatives which link to the TRIPSI framework priority areas. Since 2016, my department has invested approximately £54 million through TRIPSI framework initiatives. In the current financial year, I've allocated £1.92 million of resource and £5.72 million of capital to deliver on these initiatives in the proposed TRIPSI action plan for this financial year. Ongoing initiatives that help to address poverty, isolation and lack of access to services in rural areas include the Rural Micro Capital Grant Scheme, through which 1,874 letters of offer have been issued to voluntary and community sector organisations, awarding £3.1 million to purchase capital items which help address locally identified poverty or social isolation issues. The Rural Support Charity, which has been issued with a contract for funding for 3 years until the end of March of 2027. The Village Catalyst Programme, which addresses rural dereliction and provides rural community facilities in conjunction with the Department for Communities. The continued delivery of the Rural Community Development Support Service by the Rural Support Networks, which builds on the capacity of the voluntary and community sector, and the support for rural businesses through the Rural Business Development Grant Scheme, which awarded £2.6 million to 763 applicants last month. From 2015-16 to date, my department has contributed £2.22 million to the Rural Regional Infrastructure Support Programme, delivered by the Department of Communities from the TRIPSI budget, including £750,000 to support the Women in Disadvantaged Areas strand. The overall aim of the Rural and Disadvantaged Areas strand is to help tackle disadvantage and social exclusion, recognising the specific challenges faced by women in disadvantaged and rural areas and empowering them to have a voice in tackling these issues and meeting their needs. The Training for Women Network are the lead partner of the consortium delivering the Women in Disadvantaged Areas strand, and I would like to thank them and all the work that they do in leading this work, and also the Northern Ireland Rural Women's Network for the role they play in representing the interests of rural women on key policy issues and also, importantly, future policy development. All of this, along with the ongoing £26 million COVID Recovery Small Settlements Regeneration Programme, funded by my department, Communities and Infrastructure, is a significant investment for rural people, rural communities and rural businesses, and illustrates my commitment to building strong, sustainable and, importantly, diverse rural communities across Northern Ireland. I recognise that transport, as has been outlined, is a significant issue for those living in rural areas. The Department for Infrastructure, as the policy lead department for rural transport, provides grant aid from their rural transport budget to the 11 rural community transport partnerships across all of Northern Ireland to deliver their Dial-a-Lift scheme. Since it was introduced in 2011-2012, DAERA has provided funding of just over £8 million to the Department of Infrastructure to support the delivery of the Assisted Rural Travel Scheme. The Assisted Rural Travel Scheme permits rural dwellers to use their Smart Pass and rural community transport vehicles provided through the Department of Infrastructure's Dial-a-Lift scheme. This provides free or half-fare travel and ensures equivalency in access for services for urban and rural communities. In recent years, my department has provided £560,000 annually to the Department for Infrastructure. It is intended that this is transferred to the Department of Infrastructure as part of the budget for next year and included in that department's baseline for future years. My officials will continue to meet with counterparts in the Department of Infrastructure to ensure the needs of rural dwellers are adequately considered. A working group has been established which includes officials from Department of Infrastructure, Health and also my department to consider whether transport in the community can provide a more cost-effective, value-for-money service delivery model to meet the needs of rural users. It will also investigate the potential for community transport providers to be part of a collaborative group of transport options and pathways that can be accessed by the population. I recognise that access to adequate childcare services is a real issue for many families living in rural areas. The Department of Education are responsible for leading on the Executive's early learning and childcare strategy. My officials have been working with their counterparts in that department to help ensure that the needs of people in rural areas are properly considered. Access to childcare is a significant issue, and I recognise we need to take action in relation to that. Access to healthcare services is also a matter of significant concern for women living in rural areas, as has been outlined. The Foreign Families Health Check Programme is a regional initiative funded by my department and the Public Health Agency and delivered by Northern Health and Social Care Trust. Since 2012, 26,600 rural dwellers, primarily farmers, farm workers and farm family members, attending marts and community events have been screened, and in 2024-25, 1,865 checks have been carried out to the 31st of January of this year. In many cases, the health check has flagged the need for further intervention, and the screening result is forwarded to the client's GP for consideration and action. A follow-up phone call is organised 3 months later to reinforce health messages. The loss of services such as banking and schools is also a matter of great concern to those who live in rural areas. My department will work with other departments and public bodies to try to address any issues where these occur. As I bring my remarks to a conclusion, I would like to look to the future and mention a couple of initiatives which my department are currently developing, which I hope will have a significant impact for women in rural areas in the years ahead. As Minister, I established a new rural policy unit on the 1st of April of last year, which has been tasked with developing future rural policy for Northern Ireland following our exit from the European Union and the closure of the Northern Ireland Rural Development Programme. In developing its future rural policy, my department will take into consideration the learning from previous rural policy initiatives in place in Northern Ireland, the available rural research and other evidence that other parts of the UK are doing, and also in Ireland, in relation to rural development. As I said earlier, I recognise that all departments are responsible for exercising their functions in both urban areas and rural areas, and in developing its rural policy, my department will be engaging with other government departments to explore future opportunities for supporting rural communities and to identify how DAERA can work more effectively with them in the future to help deliver better outcomes for rural dwellers. My department is committed in its current business plan to developing for consultation this new evidence-based rural policy. I am committed to engaging closely with rural stakeholders to provide an opportunity for them to inform future rural policy. I have met with rural stakeholders and reiterated my attention that co-design and collaboration will form a central element of this policy. This important work is progressing at pace, and early draft proposals have been shared with stakeholders and also the ERA Committee. My officials will continue to engage with rural stakeholders, and it is my intention that draft proposals will be consulted upon later this year. Finally, I would just like to touch upon the role of women within farming. My Department's Sustainable Agriculture Programme will have a key role in the delivery of a number of draft programme for government priorities, together with my key priorities through driving to achieve its 4 outcomes of improved environmental sustainability, enhanced productivity, stronger resilience and also an effective functioning supply chain. Women contribute greatly to the operation of family farms in Northern Ireland, and it is important that the industry moves forward in a way that supports and encourages women to take on leadership roles both within the farm businesses and across the wider sector. As my department develops the specific schemes within the Sustainable Agricultural Programme, we will take appropriate actions to encourage the participation of women and underrepresented groups. I welcome the recent work by the Ulster Farmers Union, the publication just recently of the National Farmers Union of Scotland in terms of their report around these issues, and I am keen to work with industry in terms of exploring how we can encourage the better participation of women within agriculture. I regret that due to prior commitments I will not be able to stay for this entire debate, but I would like to thank you for the opportunity to speak here today. Thank you for coming here and thank you for this contribution. Thank you.
Thank you. I call Ashley Najala.
Thank you, Mr. Speaker. In the months after giving birth to my son, I wanted to die. Instead of the joy and wonder I had expected to feel after my beautiful boy came into the world, I was overwhelmed by the demands of motherhood. Long days gave way to longer, sleepless nights. The smallest of tasks became insurmountable, to the point that I didn't want to leave the house. I didn't get to enjoy that newborn scrunch, to marvel at this little life I'd grown inside me. The dark clouds of postpartum depression descended, and I was robbed of those moments. When I reached out to the midwives and GPs in those first months, I was told it was the baby blues and it would go away. It didn't. 18 months later, I had reached breaking point. Statutory services had failed to give me help or support, and I felt completely alone, and that I was failing as a mother. It was then, at my darkest point, that I heard about the MAS project. Standing for maternal advocacy and support, the project offers peer support groups in the local community for mothers who are struggling with their mental health. Suddenly, I wasn't alone anymore. Every week, I could put my son into childcare for 2 hours while I had a hot cup of tea and chatted to mums in a similar position to me. We did crafts, we had talks about well-being and activities such as yoga. It was amongst these mothers, this community of care, of openness and trust, that I finally began to experience healing and see the light at the end of the tunnel of postpartum depression. The statistics surrounding maternal mental health are stark. 1 in 5 women suffer from perinatal mental health issues during pregnancy or within the first year after birth. Indeed, 40% of deaths within the first year after pregnancy are due to mental health-related causes. The Maternal Mental Health Alliance also report that 70% of women hide or underplay their mental health symptoms postpartum.
Will the member give way?
Yes.
Thank you, Mr. Speaker. I'm Hazel Wilson with WRDA. Would the Speaker agree with me that early indication of maternal mental health problem is essential? I would encourage implementation of the recommendations in the Renfrew report and the need for coordinated system change. These parallel with the MAS Matters campaign, where women emphasise the need for continuity, compassion and signposting. There is often no consistency in the care women receive. The rollout of continuity of care will improve care and build relationships, because relationship building is important. I have personally experienced the drawbacks from lack of continuity as well as the benefits of consistency. During my second pregnancy, my mental health declined rapidly, and what made the situation unbearable was the fact that every midwife appointment I went to was with a different midwife, and they all wanted to hear the whole story. I found this re-traumatising, and my mental health was taking a further dip. During my third pregnancy, my mental health was bad from the start due to other circumstances. I was therefore able to say that I knew the inconsistency from my last pregnancy had been detrimental and was something I felt needed to be addressed. I was a single mum to 2 under 3, and I couldn't maintain the process of telling my story, and I was therefore referred to the perinatal mental health midwife. The development of continuity of care and cultural change that is needed must be supported at a leadership level. And I would also highlight the need for women's health and maternity strategy in Northern Ireland. Thank you.
Thank you, Hazel. Northern Ireland is also the only part of the UK with no mother and baby unit. We need plans for this unit to progress as soon as possible so that mums with the highest level of need can receive the specialist care they need with their babies. Speaker, we need to foster a culture of openness and care towards mothers, where we are listened to and met at this vulnerable point in our lives. Although we welcome the recent set-up of specialist perinatal mental health teams for women who are severely unwell, there is still a need for specialist support for women who do not meet these strict criteria. The MAS project offers this support in a community environment and is run out of women's centres that are already embedded within the communities they serve. This allows for access by those who are affected by social inequality and disadvantage, who are statistically more vulnerable to maternal mental health issues.
Will the member give way?
Yes.
Thank you, Mr. Speaker. Would members also recognise LGBTQIA+ women as a marginalised group who are disproportionately affected by social inequality and are statistically more likely to be vulnerable to mental health issues and lacking maternal mental health support? Here NI are an organisation who support LGBTQIA+ women and their families throughout this region. Despite this organisation offering a lifeline to women who are looking for social integration and to meet families like their own, Here NI's work remains underfunded and undervalued by government departments. The sector are still waiting on an LGBTQIA+ strategy to address some of the issues facing LGBTQIA+ women, such as increasing rates of poor mental health, including maternal mental health, the high cost of fertility treatment, and access to gender-affirming healthcare. A lack of integration of LGBTQIA+ women's needs in healthcare policy will have a direct impact on the mental and physical health of an already marginalised group. Will the Chamber acknowledge this intersection and commit to the delivery and resourcing of a cross-departmental LGBTQIA+ strategy to address these healthcare inequalities?
Thank you, Sophie. A study by the Centre of Mental Health and School of Economics showed that perinatal mental health problems carry a long-term cost of around £8.1 billion each 1 year of cohort births in the UK. Therefore, addressing maternal mental health issues within an early intervention community framework not only benefits mothers but the economy at large. We call for funding for long-term community-based peer support programmes for mothers and expectant mothers such as the MAS project and clear signposting to these services. By doing this, we can offer women the consistent, caring support that they deserve in those early years of motherhood. Thank you, Mr. Speaker.
Thank you. I call on Dr. Joan Smith. Good to see you again, Joan.
Thank you, Mr. Speaker. It's a pleasure to be here on behalf of Women's Forum, and we wish to address the health issues, loneliness and caring responsibilities that older women face today. According to HNI, the leading cause of death for older women is heart disease and circulatory problems. And in 2022 in Northern Ireland, 1,977 women died from heart or circulatory diseases. And currently, 26,000 women in Northern Ireland are living with heart disease, which kills twice as many women as breast cancer each year. So in 2024, the British Heart Foundation in Northern Ireland found that women with heart disease are disadvantaged at every turn, are inadequately equipped with information on symptoms, are more likely than men to be misdiagnosed or have a diagnosis at all, and they are therefore less likely to receive timely, optimal treatment. We need public awareness of this to be raised, perhaps through something like the NHS Act Fast Stroke campaign.
Will the member give way?
Yes.
My name is Paddy Skates. I'm also from Women's Forum Northern Ireland. Mr. Speaker, these figures for women and heart disease are truly shocking. Almost 2,000 deaths a year, twice as many as breast cancer, which quite rightly gets a lot of publicity. What can be done? Early intervention is the key. Known as the silent killer because many people do not know there's a problem until it is too late. High blood pressure can be present with no symptoms, but if it's found and treated with medication, a person can go on to live a long, healthy life. Few women think of having a blood pressure check. This is why health checks, for those who do not see a doctor regularly, the assumed healthy, are vital. High blood pressure can cause damage to arteries, damage to the heart, damage to the brain leading to TIAs and strokes, damage to the kidneys or eyes, all easily preventable with medication. This is why annual or at least biannual health checks are vitally important. You take your car for an MOT once a year. You take your dog to the vets once a year. You go to the dentist once a year. To quote the NHS website, if you are aged 40 to 74 and do not have a pre-existing health condition, you should be invited to an NHS health check by your GP every 5 years. Now, how many in this room have been called for a health check? If these checks did exist, why stop at 74? People over 74, they may not be working, but their grandparents providing childcare. They're carers for elderly relatives, siblings, and sometimes children. They're volunteers who keep most of our charities going. How could health checks be incorporated into an already struggling GP system? We're called for an annual vaccination for COVID and flu. So would it be feasible to add on a quick health check, including maybe bloods, at least a BP check, and information on healthy lifestyles for those patients who have not had contact with their GP during the previous 12 months, the assumed healthy? This would not require additional appointments, but could save money in the long run, but more importantly, could save lives. Mr. Speaker, I ask that health checks for people over 40 who are not seen by their doctor for underlying health issues should be implemented without an upper age limit as soon as possible. Thank you.
Thank you, Paddy. In 2022, Age UK reported that because of the pandemic, older women had been and continued to be more adversely affected than their male counterparts, with substantial numbers reporting big adverse changes in their physical and mental health because of new caring responsibilities, or providing more support because a person's health, particularly a family member, has deteriorated and their care needs have consequently increased. The Office of National Statistics data of 2020 shows that women have longer life expectancy than men, but a shorter, healthy one. This means access to health care is tremendously important for them. Mr. Speaker, in 2023, AGNI reported that older people over the age of 75 have the highest levels of loneliness and are the most likely age group to report chronic loneliness. They reported its ensuing social isolation can increase the risk of an early death, stroke and heart disease, an increase in cognitive decline and the risk of dementia. Intervention to prevent loneliness and an extension of existing services could therefore improve the health of older people and in doing so potentially save the NHS money. Such interventions available at present are sporadic and need to be more widespread and readily available and indeed publicised. There are currently 1,896 over the age of 66 providing unpaid care, and I know that will be referred to elsewhere. But these carers feel undervalued by society, largely invisible and last to be thought of in terms of support. And the University of Birmingham estimated that voluntary health care saves the government $5.4 billion per year. However, please note that those on a state pension do not qualify for carers' allowance if it's more than £81.90. I cannot conclude without emphasising that the shortage of hospital beds, A&E wait times, etc., is impacted on by the number of older patients awaiting appropriate care package to enable discharge. There is a distinct lack of well-qualified paid care in Northern Ireland, partly due to the reduction in the working population coming from overseas, and partly due to the poor pay and conditions and lack of respect that the profession is afforded. The planned rise in national insurance will further add to these problems. Mr. Speaker, currently Northern Ireland is the only part of the UK without a dedicated plan to address the health and well-being of women. The Assembly urgently needs to redress this balance and formulate a plan for a comprehensive women's health strategy and to ensure that older women have adequate mention to it. To develop an action plan to address loneliness, to recognise and support those involved in caring, and to encourage the recruitment and retention of care workers, and therefore ease the burden on our hospitals. They are making a great contribution to our society. Older women are, and therefore we thank you for the opportunity to speak for them.
I call on the Minister of Health to respond.
Mr. Speaker, thank you very much, and thank you also for the invitation to speak today. May I thank everybody who has contributed so far. I think you have shown that you are articulate and that your thinking is logical in a way that this chamber seldom experiences so comprehensively. So today's motion rightly acknowledges a cross-government approach to tackling gender equality as required. And indeed, the programme for government, which is now finally not a draft programme, includes a specific objective to reduce health waiting lists and put a focus on health inequalities. And those inequalities have become a passion of mine over the last number of months. And our international research suggests it's not something that one single department can tackle. In fact, the research suggests it's only 20% health interventions, it is 40% socio-economic, 10% environment, and 30% behaviours such as smoking. So I think we should all welcome the fact that Northern Ireland will be included in the tobacco and vapes bill that is passing through Westminster. So it's vital, if we're going to achieve what we want to achieve and make real difference, that we work collectively across departments and across sectors. And that will allow us to create the conditions where people, families and communities can improve their health and their well-being, and we can reduce those inequalities. And the most shocking one is with regard to healthy life expectancy. 2 women born in this city on the same day, growing up maybe a mile apart, one in the area of least deprivation, one in the area of most deprivation, and their differential in healthy life expectancy will be 14.2 years. In a first world country a quarter of the way into the 21st century. How can we even tolerate that statistic? So I want to acknowledge the issues, the challenges and the concerns when it comes to getting access to the right care at the right time within our system. I'm acutely aware of the need to improve those inequalities, to improve outcomes throughout the life course for women and girls in Northern Ireland. So in November of last year, I helped launch the Women Health Survey. It's in partnership with Derrywell Women and with Queen's University in Belfast. And I want to hear directly from women and girls about the issues they face when it comes to their health and how they feel services should be shaped into the future. And without preempting the outcome of this piece of research, I expect many of the emerging themes to reflect those issues that I'm all too familiar with. Issues like GP access, menopause care, the significant waiting lists, and those health inequalities. And I can assure you, my department is already taking action. I've introduced a new targeted, place-based approach, which I'm calling Live Better, to help address those inequalities, bringing targeted health support right to communities, the communities which need it the most. I've also reaffirmed my commitment many times to the development of a Women's Health Action Plan. That's currently in development, and it aims to improve health outcomes for the women and girls of Northern Ireland. And, Mr. Speaker, let me take this opportunity to nail a misconception about my attitude to a women's health strategy. I am for it. What I am against is a strategy that is just empty words. A strategy should flow from a policy, and it should be underpinned by annual action plans that are costed, that are resourced, and that have the appropriate workforce. Otherwise, those empty word strategies just raise expectations only to disappoint. And I would draw your attention to the cancer strategy and the mental health strategy. The latter, for example, this year has a budget requirement of £42 million. The actual budget that has been allocated is 5.9. It's almost cruel to say this is what we can do for you and then not deliver. So to begin with, we will have a plan, and that plan will highlight the wide range of policy and service initiatives which are currently in progress. It will outline the actions and service improvements that can be delivered over the next 3 years with the aim of improving health outcomes for women and girls and identifying the priority areas for investment should additional funding become available. My officials recently held 2 successful online stakeholder engagement events. We heard directly from the voluntary and community sector and from healthcare professionals on the key priorities for inclusion in the plan. The feedback, as well as early findings from the Women's Health Survey, will now be used to inform the development of the plan. Mr. Speaker, I'd now like to take the opportunity to highlight some of the work which is currently underway in response to the issues raised here today. The Department has been overseeing a major programme of work on maternity and on neonatal services, with an immediate focus on improving governance and improving safety. Now, without getting into too much detail, as I'm limited on time, this work will result in a consolidated regional action plan that will be fundamental to improving outcomes for mothers, babies and families. It will also help inform the future strategic direction for maternity and for neonatal services. I've also announced the establishment of an interdisciplinary maternity and neonatal partnership, which will lead on the implementation of the action plan. Linked to maternity, Phase 1 of the Perinatal Mental Health Service has been fully commissioned and it's implemented across each trust, and we're ready to establish a government structure which will help shape the strategic direction and the planning of the service going forward. The Belfast City Hospital site has been identified for a dedicated mother and baby unit in Northern Ireland. The business case, which is due to be finalised within the next few months, is currently based on a 7-bedded unit servicing the Northern Ireland population and will include both capital and revenue costs. Progression of this site will remain subject to the required capital and revenue funding being identified. Through dialogue with the British Heart Foundation and others, I'm informed about the under-awareness, under-diagnosis and under-treatment of cardiovascular disease among women. I recognise there are particular challenges in terms of improving awareness of cardiovascular risk factors among women and girls and addressing any differences in terms of diagnosis and treatment. My department will continue to work closely with the Northern Ireland Cardiac Network to consider any improvements that could be applied to current diagnostic and treatment pathways. I have listened to Dr. Smith, who so eloquently outlined the issues facing older women in our society, which can have a significant effect on health. Supporting individuals to age well and to live well within their own community is a key priority for me and my department. We are, as we know, in an ageing society, and with women living an average of 3.8 years longer than men, it naturally follows that an increasing number of women may find themselves living alone in a stage of life where they may require additional support, have mobility issues, and health problems. Where loneliness is prolonged or severe, we know it may increase the risk of some physical conditions, such as dementia and mental health conditions, including stress, anxiety, and low mood. No organisation or government department can solve this alone. However, my department, in recognising the impact on health and well-being, has established a loneliness and social isolation forum to engage with other executive departments as well as with our own UK and Republic of Ireland counterparts. I'd also like to respond to the issue of caring and of carers. And while this was discussed earlier, this can impact women of all ages. According to the most recent NI census, around 20% of women aged over 40 are providing unpaid care in Northern Ireland. Unpaid carers play a crucial role in supporting our health and social care system. They provide care for families and friends with little or no compensation. There are multifactorial impacts for women who are carers. For example, high state pension ages mean many women will be working in paid employment roles for longer and therefore are more likely to be working while also carrying out caring duties. Many women carers can face physical health challenges also in their caring role due to heavy lifting, support and managing daily tasks for those they care for, which can lead to back pain and musculoskeletal problems. Other issues relating to female unpaid carers include risks of anxiety and depression due to the loneliness and the isolation that can be felt as an unpaid carer. Mr. Speaker, I'm conscious I'm coming to the end of my allotted time. I have to leave when there's much more I could say about the ongoing work of the department relating to all this. But I want to finish by just acknowledging the presence of Fiona Monaghan. I very much enjoyed working with her as a member of the all-party group on UNSCR 1325, Women, Peace and Security. And when I left, we were looking at the importance of gender budgeting for the executive. And indeed, I was hoping to introduce a private member's bill in that regard. But now that I'm in this role, I am prevented from doing so. And while it's not my job to set the agenda for the all-party group, I would encourage you to look again at gender budgeting and its potential impact on how women are treated and respected and whose services are delivered by this executive and its executive departments. Thank you.
Thank you, Colonel. Heisa Balduino.
Thank you, Mr. Speaker. On March 23, two mothers launched Melted Parents, a social media campaign dedicated to sharing the stories of parents struggling with the childcare crisis in Northern Ireland. Since then, Melted Parents has grown into a grassroots lobbying group driven by 7 women who balance full-time careers and motherhood while representing the voices of parents in the fight for high-quality, fully accessible and affordable childcare in Northern Ireland. I'm one of the 7 women. My name is Heisa Balduino. I'm an immigrant, a woman of colour. I'm a mum, a full-time worker, and I'm here today to speak on behalf of families affected by the childcare crisis. Families that include the over 20,000 women who directly support our campaign and the countless others who struggle daily. Their stories fill our inboxes every day, and today I want to share just one of them, my own. I moved to Belfast 12 years ago and have been married to a local man for almost 11 years. Without family nearby, we waited to have children until we were financially ready. We had a house, full-time jobs, and savings. We thought we were prepared, but no matter how much you plan, nothing prepares you for the cost of childcare in Northern Ireland. Just last week, I received the dreaded letter, another childcare fee increase. This year alone, our costs have risen by £233 per month. That's almost £3,000 per year for one child, 35% hike after the government support. What family sees their income grow by 35% in a year? This isn't just unsustainable, it's outrageous. Me and my husband felt hopeful after the introduction of the subsidy scheme, We believe that this meant the executive would finally take action to address the crisis. For the first time, we thought we could grow our family. We were excited, filled with dreams. This didn't last long. We are now more worried than ever about the future and are reconsidering our choice. And yet, even after all of this, my family is still one of the lucky ones. My husband and I earn decent wages, so we can absorb the increase without going into debt, but we are the exception. Thousands of families are struggling to get by on minimum wage, with many receiving no support while facing overwhelming costs. And who suffers the most? Women. Care work has been devalued and feminized, seen as women's responsibility rather than a societal one. While the childcare crisis affects everyone, it disproportionately harms women, pushing them out of the workforce into poverty, and in some cases, trapping them in violent relationships. And women don't just rely on childcare, they provide it. Yet most childcare workers, mostly women, are underpaid and lack job security. A comprehensive childcare strategy needs to address all of these issues, and its delivery has become more urgent than ever. Unfortunately, we keep hearing the executive mention the subsidy scheme as if it has solved the childcare crisis. It hasn't. The scheme was an emergency intervention that supported only a small portion of affected families, and just a few months later, its impact has been erased by soaring childcare fees, leaving most families in an even worse situation. Now, when we should be consulting on a comprehensive strategy, we found ourselves back where we were a year ago, fighting for urgent intervention, this time on top of the urgent intervention, and the strategy is still nowhere to be seen.
Yes. Thank you, Mr. Speaker. My name is Dervla, and as a mother of two and someone who works in the Falls Women's Centre, a community-based childcare setting, I'm extremely aware of the critical role that these organisations play in women's careers, mental health, and their children's development. Many families breathed a sigh of relief when they heard about the Northern Ireland Childcare Subsidy Scheme, aiming at reducing childcare costs by 15% for eligible working parents of qualifying children. They thought, finally, we might be given a break with the eye-watering cost of childcare, but unfortunately the reality isn't as hopeful. The private sector makes up a huge proportion of their fees to The private sector makes up a huge proportion of childcare providers, and due to inflation and rising costs, they have had to increase their fees to stay afloat, meaning the subsidy offered isn't financially benefiting working families. In my opinion, the executive needs to invest in community daycares to ensure working class families aren't priced out of employment. According to the Community Daycare Network Research 2024, 78% of these centres are located in the most deprived areas in the north, and a shocking 48% of them describe their financial situation as struggling, focusing on simply surviving within the next 12 months. Without these centres, women from deprived areas will be priced out of work, with private daycare settings completely out of their budgets. Do we really want women to feel as though there is no point in working and they're better off in benefits? Having the option to work is paramount for women's mental health, and I know personally how true this is. The high quality and affordable childcare setting the Falls Women's Centre provided allowed me to join the MAS project, which offers mental health support to women who are pregnant or have children from age 0 to 3. Being able to access this childcare allowed me to gain qualifications as group leader and progress into becoming the project worker for our centre. This has improved my confidence massively, in addition to my quality of life. It has also given my children the most amazing start to life, thanks to the exceptional level of childcare provided. The women's childcare model of community-based childcare also allows the mothers in my group to avail of daycare 1 morning per week, which is funded by MAS and is at a lower cost. During this time, these women engage in training such as paediatric first aid and mental health awareness talks, arming them with the tools and knowledge to be able to be the best versions of themselves. I hope you can see, Mr. Speaker, that community-based childcare isn't simply about families' bank accounts. It's about our mental health and our children's emotional, physical and social development. The time is now for a robust plan for community daycare provision. Thank you.
Thank you, Dervla. Mr. Speaker, the situation is beyond disappointing. It's a failure of leadership, and Northern Ireland families are paying the price. We need all political party representatives to act with urgency to deliver on what was promised. That's why we're urgently calling for an expansion of the subsidy to anyone using registered childcare, The subsidy cap to be reviewed and increased so more families can access it fully, ensuring that the scheme provides meaningful financial relief. Fee increases and hidden costs to families to be monitored, including changes to discounts, closure days, calculation methods, and discrepancies in rates between part-time and full-time places. Childcare fees to be published and transparency ensured, so parents have clear and accurate information about costs, promoting fairness and accountability across the childcare sector. And after almost 2 years of lobbying for high-quality, affordable, and accessible childcare, one thing is clear. As long as early years education is driven by profit, prioritizing money over quality, affordability, and accessibility, this crisis will not be solved. If you want a system that truly serves families, supports women, and provides quality care, we must challenge the status quo. Our government needs to stop passing responsibility to the for-profit sector and to the unpaid labor of women. The executive needs to start making bold choices and transform a system that isn't working. The childcare strategy is an opportunity to lead in investing in community-based childcare, centering families, creating excellence in early years, and supporting the women who are the backbone of our society. Let's seize this moment to create a legacy of care, equality, and opportunity for generations to come. Thank you, Mr. Speaker.
Thank you. I call Christiana Olijo Mule. Christiana.
Thank you, Mr. Speaker. I'm speaking on women in the economy from NIWBG, and intersection between women and economy refers to the way in which economy influences and is influenced by the economic system, policy, and structure. Women participation in workforce, both formal and informal, is often undervalued or underpaid. Women generally earn less than men for similar jobs. This has been long-term impact on their wealth accumulation, retirement savings, and economic independence. Women face many challenges within and outside of the labor market, such as the gender pay gap, access to resources, opportunities, discriminations and bias, and unpaid labor. A large proportion of women work is unpaid. The labor support the broader economy but often invisible, underappreciated, and not factored into the economic calculation like the GDP, despite its essential role in sustaining community and economics. Women stay at home to raise children who become doctors, lawyers, MLEs, but they are never seen as doing anything to grow the economy. Hence, the significance of women in economic growth and development cannot be overstated. Women represent a critical force in driving both local and global economics, contributing in unique ways that leads to broader prosperity and sustainable development. When women are economically empowered, the entire society benefits socially, culturally, and economically. Women often create businesses that address unmet needs in the local community, which can foster economic growth and job creation. The COVID-19 pandemic had had a disproportionate impact on women. Many women work in the sector that are hit hardest by the pandemic, such as healthcare, retail, and hospitality. Furthermore, the lockdown and school closure intensify women's caregiving responsibility, leading to increased job loss, economic insecurity. United Nations Sustainability Development Goal, SDGs, the Goal 5 says gender equality, focus on achieving gender equality and empowering all women and girls, while the SDG 8, which aims to promote inclusion and sustainable economic growth, employment, and decent work for all, is also directly related to women's economic participation. Therefore, I must stress the importance of providing equal access to education and vocational training for women.
Will the member give way?
Yes, I will.
Thank you, Christiana. Thank you, Mr. Speaker. I'd like to add my perspective as a woman working within a women's centre in Northern Ireland, where we support women in returning to work every day. As we know, one of the most significant barriers women face in the workforce is the high cost of childcare. For many, childcare expenses can be so high that they actually outweigh the financial benefits of returning to full-time work. This alone makes it difficult for women to even think about future employment or re-enter the workforce. For those who do, it often limits their ability to advance professionally. Part-time and flexible roles are often seen as a solution. But for many women in Northern Ireland, these jobs are lower paid, less flexible than expected, and come with fewer opportunities for career progression. This can have long-term impacts on financial security, including pension contributions and savings. Another challenge that women face is the motherhood penalty. Women who have children often experience fewer opportunities for promotion, lower pay, and even discrimination when it comes to maternity leave or requesting flexible hours. This only widens the gender pay gap. In addition to these professional barriers, mental health plays a crucial role in the challenges that women face in the workplace. The stress of balancing work life, childcare, and home responsibilities can be extremely overwhelming, particularly in my circumstance, a single-parent household. Many women often struggle with anxiety, depression, and burnout from balancing the workload of employment, family life, pregnancy, and unfortunately, folks, the list goes on. This, however, isn't empathised with in many workplaces. In some cases, folks, this will be ignored. Personally, I can relate to these issues. Before finding Atlas Women's Centre in Lisburn, my place of employment, I struggled with serious mental health issues. I lacked self-belief and I lacked self-worth. During that stage in my life, I was existing, not living. I started in Atlas as a service user in need of support. They offered me 18 one-to-one counselling sessions, skill set training and accreditation, wellbeing workshops, and lastly, really, a sense of purpose that I never knew that I needed. They even offered me a short voluntary role, and now almost 3 years later, I'm currently employed by them and receiving the support that I need to flourish in my career. However, not everywhere is like Atlas. I got lucky. These barriers that we are speaking of this afternoon, plus high childcare costs, limited opportunities in part-time work, and the motherhood penalty make it extremely difficult for women in Northern Ireland to achieve financial independence and career success. Ultimately, they leave many women at a disadvantage in the workforce, further adding to many mental health challenges that we face. If we want to create a truly inclusive, supportive work environment, we must acknowledge the high childcare costs, the mental health struggles that women face daily, and provide accessible support alongside policies that address these systemic failures. Thank you, Mr. Speaker.
Thank you, Rachel. There's a need for stronger policy that supports women's participation in economy, such as equal pay law, maternity leave, and support for female entrepreneurs. And together, we must advocate for challenging traditional gender law that resists women's economic freedom. I call on all MLAs to encourage continued efforts towards policy change, creating a level playing field, and investing in women's education and entrepreneurial venture. Finally, I would like to highlight the importance of collective actions and the need for both women and men to advocate for gender equality in the economy. Thank you, Mr. Speaker.
Councillor Vaughan Harding.
Thank you, Mr. Speaker. I rise to speak about unpaid care. Unpaid care is a gendered issue. Census figures show that nearly 60% of unpaid carers in Northern Ireland are women. Figures from Carers UK show that women have a 70% chance of providing care in their adult life and are more likely to care early in their life. Carers NI research shows that unpaid carers are saving Northern Ireland's health service £5.8 billion in care costs each year. Despite this, many unpaid carers are struggling without adequate support, trying to balance work and family with care, and many are living in poverty. Carer Poverty Commission figures show that 28% of carers in Northern Ireland currently live in poverty, higher than the rate in the rest of the UK. Carers allowance, the main social security benefit for carers, is paid at just £81.90 per week. 70% of those who receive carers allowance are women. Research by Carers NI shows that 76% of respondents to their research felt that the current rate of carers allowance is insufficient to meet their financial needs. Providing unpaid care can have a negative impact on women's health and can limit their ability to participate in public life. It can impact on women's financial security if they're unable to work or limited in the work they can do.
Will the member give way?
Yes, I will.
So, my name is Natasha McClelland. I'm an unpaid carer. I provide high-intensity care for my 2 children, now dependent adults, with multiple and severe disabilities, and I work full-time. Caring is hard and it's constant. I describe myself as one person leading 3 people's lives, so it is no surprise that I struggle. I am always exhausted, highly stressed, and on the verge of burnout. Like many other unpaid carers, I'm simply hanging on by a thread, living in survival mode. Providing care has many damaging consequences for the carer, with many experiencing immense care burdens, including poor health outcomes, increased poverty, and the inability to work. For me personally, caring massively impacts on my life. Over the past few years, my health has significantly declined because of caring. It has a huge impact on my career. It hinders my employment opportunities and career progression, which in turn reduces my earnings and pension contributions. It also impacts on my social life. Time for me away from caring is virtually non-existent. Unpaid carers play a critical role in society by selflessly providing vital care and support to those they care for. Yet despite our sacrifices, carers like me remain unseen and ignored with little or no statutory support. Unpaid carers are struggling and we are suffering because our government is choosing to ignore us. Our legislation is not only outdated, but it has not even progressed to the same equivalence as GB or Ireland. Carers urgently need legislative reform across a spectrum of areas, but particularly in employment, health and social care and welfare. It is in these areas that the current government policies are so inadequate it is beyond belief. And it is these inadequacies that shape and permeate the structural disadvantages and inequalities that we as unpaid carers experience. Unpaid carers are being punished for simply caring. I am calling on our ministers to urgently make the legislative changes that are being discussed here today and beyond, so we can stop the needless suffering of carers.
Thank you, Natasha. Mr. Speaker, research by Women's Support Network on behalf of the Women's Regional Consortium and with Carers NI on women, unpaid care and employment showed that 1 in 3 women have given up work to care. 1 in 4 women have decreased their working hours due to a caring role, and 1 in 6 women have taken on a less qualified job or turned down a promotion to fit around caring responsibilities. There is an urgent need to recognise and value the huge contribution that unpaid carers make to our society. Carers NI and the Women's Regional Consortium have recommended that the Northern Ireland Assembly should legislate for paid carers' leave from work and a day one right to request flexible working for all carers. Reviewing the value and eligibility criteria for carers allowance. Reform of the social care system to provide reliable, consistent, high-quality replacement and support care. And delivering a fit-for-purpose and affordable childcare system across Northern Ireland, including appropriate childcare for children with special educational needs. As the Gender Equality Strategy Expert Panel report notes, debates around care are dominated by the idea that the solution is to make it easier for women to balance work and care responsibilities. However, unless a universal caregiver approach is adopted, where the expectation and reality is that men are equally expected to undertake care responsibilities, then this will continue to act as a barrier to gender equality. I'm going to finish with a quote from a carer highlighting the impact of combining work with unpaid care. Juggling work and caring takes its toll. I've had more sick leave in the last year than in my previous 19 years in this job. I've no doubt that's due to the stress of juggling caring and full-time work. Your head's always sort of split. You're worried about what's coming next, plus you're trying to focus on your job. You're kind of going, how am I giving this my all if my head is elsewhere? It's constantly trying to juggle things, and it's exhausting. Thank you, Mr. Speaker.
I call on Farah Black.
Thank you, Mr. Speaker. I'm here today on behalf of Disability Action. They wanted me to share my story here today. But firstly, I would like to dedicate the speech I'm about to make to my beautiful sister-in-law, Justine Sharif Hill, who was a huge advocate for women doing it for themselves. She was a mentor for women in business, who sadly passed away on the 30th of May 2024 after a very short, ferocious battle with everyone's foe, cancer. I'll get back to my story. In 2016, I was faced with Hobson's choice. Keep my septic leg, face imminent death, lose my leg, and with it my independence. I chose my leg for as long as I could. I could not imagine a life without my limb. And when I became too poorly to make that choice, my husband chose my life. I was so angry with everybody, with the universe even. I wanted to die. All of the colour had drained out of my life, and it was black. I could no longer look after my basic needs, and to this day, it still is a struggle at times. I missed my working environment and feeling needed. My husband and I were officially deregistered as foster carers after 9 years of fostering teenagers because I was deemed too disabled. On the 16th of July 2016, I ceased to exist. I became Farah Black, the amputee, or Farah Black, the invisible. I gave up counting all the things I couldn't do. I lost count, and my world, it became smaller. My world became my home, sometimes my garden. My 6-year-old son stopped coming to me for help. And then my world just became my bedroom. On the 6th of January 2019, I developed sepsis again and had to undergo further surgery. Following this procedure, I suffered respiratory arrest, witnessed by my then 9-year-old son. On the 26th of January 2019, there was no option but to amputate me again to save my life, and my chances of survival on the operating table were put at 20%. I survived for a reason. My reason became to change the way people with disability are having to live. I have been turned away from bars, restaurants, clubs, shops, because they cannot accommodate my wheelchair. I can't access some services or businesses because I can't climb the stairs to get to them. Even a 2-inch step is a mountain for me. How is any of this right in 2025?
Thank you, Mr. Speaker. My name is Dr. Alicia Jasinska-Piarlo, and I am here today to ask what is the government's strategy to support women with invisible disabilities? Firstly, in pursuing diagnosis and then pursuing successful careers. I am a cardiologist and data scientist, and I have an invisible disability. Yet, I had to access the private healthcare to receive a diagnosis and have formulated a management plan. Unfortunately, thousands of women in NHS, in Northern Ireland, are unable to access NHS services for neurodiverse conditions such as autism and ADHD because healthcare trusts are hemorrhaging psychiatrists at an alarming rate. These are not only psychiatrists, these are clinical psychologists and educational psychologists. We need a government strategy to recruit and retain adult psychiatrists, adult psychologists with an interest in neurodiversity who will support this group of women. We need as well a comprehensive data collection on the prevalence of invisible disabilities in the workplace. Additionally, we must explore ways to support the recruitment and the retention of this highly talented group of women in their workplaces. Thank you.
Mr. Speaker, women like me who want to work, who are more than capable of working, can't because they cannot get themselves to and from work, or the workplaces are not accessible. Women with seen or unseen disabilities are still living in the dark ages. Intelligent, ambitious, and highly driven women are unable to work because accessibility still remains an issue. Northern Ireland is missing out on employing these incredible women. I want to change that. I have a plan, and I have a mission. I want to create the world's first all-access country, Northern Ireland. A place where the disabled can work, shop, live, eat out freely, access transport, tick all the appropriate boxes on websites relating to disability with confidence. I want people with disability to be able to make spur-of-the-moment trips out, to be able to book a taxi instead of having to plan weeks in advance, and physically call and check every place they are visiting to ensure that they do actually cater for the disabled or those of us in wheelchairs. With the correct support, changed legislation whereby it is law to have the appropriate facilities for the disabled, so there's appropriate access into business and services, and it's not just treated like a tick box exercise. With the appropriate funding, we will put Northern Ireland on the map as the world's first and show the rest of the world, yes, it can be done. Thank you.
I call Sonia McMullen.
I work for an organisation called Women's Aid Federation, and we work for and on behalf of 8 local women's aid groups across Northern Ireland who provide emergency accommodation and outreach and so much more to women, children and young people. Mr. Speaker, in Northern Ireland, a shocking total of 25 women have been murdered in this jurisdiction from 2020. These women were overwhelmingly killed or suspected to be killed by someone known to them, often in their own homes, a place where we all should be safe. These statistics are shocking, seriously concerning, and highlight the need for immediate action to tackle violence against women and girls in our community. In 2023-24, we witnessed the 3rd highest levels of domestic abuse ever recorded, with the PSNI recording 33,763 domestic abuse incidents, which averages an incident every 16 minutes of every day. And we know this is only the tip of the iceberg, because many people never report these crimes. We're aware that domestic abuse can impact on anyone, but it's clear from research and statistics that it is a gendered crime and it does disproportionately affect women and girls. In March 2021, Women's Aid launched a strategy. We were the only part of the UK that didn't have a violence against women and girls strategy. And such was the public demand to tackle this issue that the petition got thousands of signatures. And following support from the Northern Ireland Assembly, the Executive, and a meaningful co-design process, many of which people today were involved in that, we were delighted that the Ending Violence Against Women and Girls Strategic Framework was finally introduced in 2024. And we were really pleased to see the inclusion of an Ending Violence Against Women and Girls strategy in the draft programme, this area, for the draft programme for government for the very first time in this jurisdiction, and we look forward to Monday to hearing more about that. In this same period, we welcomed a whole raft of new legislation, the domestic abuse offence, which is the coercive control legislation, which included a child aggravator, stalking legislation, non-fatal strangulation, the introduction of domestic homicide reviews, Operation Encompass, Safe Leave Act, and many other provisions under the Justice, Sexual Offences and Human Trafficking Act. So all tools that can help to tackle violence against women and girls. But we need, of course, to monitor and scrutinise this legislation. How is it embedding itself? Because it was in the absence of any funding to resource these pieces of legislation, which is of great concern. We also had a legal aid waiver, which was introduced through the Domestic Abuse and Civil Proceedings Act for Article 8 proceedings in the Family Court. Very low uptake in relation to that. So we are really concerned around access to justice, specifically in relation to civil legal aid. We've also seen the launch of the new Domestic and Sexual Abuse Strategy, which Women's Aid have played a pivotal role in shaping and informing, and particularly with the voice of our children and young people who successfully helped us lobby and campaigning for the inclusion of a children and young people's pillar, which finally highlights the traumatic impact domestic abuse has in the home for children and young people in our society, detrimentally impacting on their well-being. But despite this work, Women's Aid Federation are disappointed to not have our core funding restored by the Department of Health, and I'm disappointed that the Health Minister has left for this piece. None of this pot of funding that was released in the last few weeks went to any women's organisations. This news, given the advances we have made and the opportune position we are now in with the new strategies and clear action plans to address domestic abuse and all forms of violence against women and girls, it limits our ability to help bring the voices of women, children and young people affected by abuse into the room. These voices deserve to be heard loudly by decision makers when discussing any policy that directly impacts on victims. Yes.
Thank you. Thank you, Mr. Speaker. Mr. Speaker, my name is Karen Devlin, and as a women's aid worker, I stand here today to protect the anonymity of a survivor of domestic abuse, whom I will call Amy. I will share her words as she wishes this chamber to hear them. In 2017, I was physically attacked by my then partner. He attempted to strangle me. He was convicted, but at that time, non-fatal strangulation was not a specific crime in Northern Ireland. He was only found guilty of common assault. Since then, new laws have been introduced to protect women experiencing abuse, yet 43 women and girls have been murdered here since 2017, and demand for support services remain high. I now work with women and children who tell me protection orders meant to keep them safe are not being properly enforced. They are terrified in their own homes, trapped in the fear that their perpetrators remain free. I know my abuser has hurt other women since. He is active on dating websites. Not knowing where a perpetrator is or if they will strike again is terrifying for women. To truly protect women and girls, we need greater cooperation, information sharing and transparency between all parts of our society, including the criminal and family courts. Women are being repeatedly brought to family court by the perpetrator as a means of continuation of their abuse, despite conviction in the criminal court for their perpetrator. If we are serious about ending violence against women and girls, we must meaningfully embed education on healthy relationships, gender stereotypes, and the roots of misogyny into the curriculum. We must confront the rise of online misogyny, which fuels real-world harm for women and girls. Violence against women and girls is a national emergency, yet we do not treat it as one. During COVID, we acted swiftly and collectively to protect lives. The pandemic of violence against women and girls is a crisis that demands the same urgency, commitment and cooperation. We must treat the threat from perpetrators as seriously as the threat from the virus. We must understand the importance of respectful relationships, just as we understand the importance of hand washing during COVID. We must insist that the authorities work together to protect women, just as they did to protect all of us during COVID. Ending this pandemic of violence against women and girls is everybody's responsibility, and it's time we all rose to take up this challenge. Thank you, Mr. Speaker.
Thank you, Karen. Thank you for highlighting the importance of listening to the lived experience of survivors, which is essential to shape any policy, legislation and awareness as we as a society try to tackle violence against women and girls. In conclusion, society must stand united in the fight against violence towards women and girls, recognising that this issue not only affects individuals, it affects all of us in society. We must collectively challenge harmful norms, strengthen legal protections, and provide resources for support and empowerment. Education and awareness play a vital role in fostering respect, equality, and understanding. And each of us must take responsibility to create environments where women and girls feel safe, feel valued and feel heard. Only through shared commitment and action can we end this cycle of violence and ensure a future where women and girls thrive free from fear and discrimination. Thank you, Mr. Speaker.
Thank you. I call Aisling Fanning.
Thank you, Mr. Speaker. Mr. Speaker, the Good Friday Agreement contained very hard-won and reasonably extensive commitments to gender equality in Northern Ireland. And Mr. Speaker, that was so long ago that I wasn't even born. But still now, 27 years later, discrimination against women remains a huge problem in this place. 20% of inquiries that are made to the Equality Commission every year relate to sex discrimination, and as Sonia just pointed out, that's only the tip of the iceberg. Beyond that, violence against women and girls is a huge issue in this place, and we need a comprehensive and cohesive solution to all of those problems that has rights and equality commitments at its core. Those commitments made in 1998 include commitments to mainstream equality considerations in public policy making and to strengthening discrimination legislation and employment equality discrimination in this region.
Will the member give way? Thank you, Mr. Speaker. My name is Jonna Monaghan and I'm with Women's Platform, and our role is to connect women in Northern Ireland to international networks and international human rights standards. And in 1998, Section 75 was groundbreaking in introducing protections for things like gender, age and disability. But today it's very clear that we need to do more. And harmonising legislation to clarify protections and streamline protections is very important in that regard. And what's absolutely crucial is integrating an intersectional lens to recognise that people have multiple identities and don't live single issue lives. So in short, what we're calling for is a single Equality Act that brings together and modernises all the complex pieces of legislation we currently have. And the sex discrimination order is now almost 50 years old. So that's just one example of how urgent this is. And what we also need is that legislation to build on international human rights standards, which are binding on all UN member states, and provide a global context that can secure rights for everyone. For the UK, there's clear recommendations on equal pay, healthcare, childcare, all the issues that have been mentioned here today. So we think that it's very urgent to introduce a framework like that that really can put equality at the heart of all of our decision making. Thank you.
Thank you, Anna. Mr. Speaker, it's clear that we need a consolidated rights and equality framework to build sustainable peace in this place. Equality has been a devolved matter in this place since 1999. Only one piece of equality legislation has ever been passed through this Assembly, and that's simply not good enough. Equality legislation in Northern Ireland is disparate, it's complex, it's out of date, and it doesn't cover all of the protected characteristics with the same level of protection. Strengthening and harmonising the legislation upwards is important for moving forward with these protections. And we need to strengthen the legislation to include more extensive protection across all of the protected characteristics. And we need to make that legislative framework accessible to all rights holders. We're dealing with an ageing population in Northern Ireland, and older women are a particularly overlooked group when it comes to equality considerations. I work with older women in West Belfast every day in our Ardmona family and community group, and these women talk all the time about how they feel left out of equality considerations. They stress the importance of adequate investment in, for example, health and social care services delivered in their communities, so that they are appropriately tailored to their needs. And Mr. Speaker, that is an equality and a rights issue. Section 75 has the potential to allow for that meaningful consideration of the equality impact of policy decisions, but only if decision makers leave adequate time to consult with interested groups on equality impact of policy decisions, only if they consider the real-life equality impacts of policy decisions, and if they consider the impact across and between the protected characteristics rather than treating those in silos. If the data isn't there, Mr. Speaker, it needs to be collected. A full review of the effectiveness of Section 75, its enforcement effectively, and the revitalisation of the provision as a tool will go a long way in harnessing its potential. Really, we need a renewed and meaningful refocusing on the commitments that were made to women in Northern Ireland in 1998 if we are going to build a society that works for all women in this place. Thank you, Mr. Speaker.
Thank you. I now call Junior Minister Riley.
And I want to start by thanking every single one of you who have come along to today's session and spoken so passionately about the issues that matter to you. Sometimes it's not easy to get up and speak in this chamber, so I want to thank you for standing up and for speaking about the very real issues that are impacting and affecting women and that women face here every single day. We know that events across society can play out with a wider impact on women. We know that inequalities still exist in many areas of life, and it's important that not only we challenge those, but we also address them, not just by our words, but also by our actions. And since the Executive returned last year, significant work has been taking place on many of the issues that you have raised today. We have made progress on a number of key areas, and yesterday's agreement of the programme for government is our commitment of doing what matters most for people, and that includes tackling all forms of inequality and embedding gender equality across our society. The publication of the PFG sets out our priorities for this mandate, and there was broad support for the commitments we laid out. We've listened to feedback provided during the public consultation, and we've made some changes as a result. We've also set realistic targets and timelines for delivery against all of the priorities. We believe that by focusing on these 9 priority areas of the programme for government, that we will create a more equitable society here for everyone. Mr Speaker, I would now like to respond to each of the statements that have been made by Reza on affordable childcare, by Christiana on women in the economy, and by Siobhan on carers and unpaid work. And I will outline how the Executive, through the PFG, intends to address some of the issues raised today. And as we've heard today, there is a need to address rising costs in childcare. Reza and Dervla has outlined so clearly how important it is to ensure that we have affordable childcare here, and we hear you. As an Executive, we know that the cost of childcare is putting a huge strain on many families. In some cases, it can hinder parents, and particularly mothers, from getting into or staying in work or progressing in their careers. Investing in childcare is an investment in our economy and our people. It's vital that we continue to explore every opportunity to strengthen our economy, to improve the lives of all of our citizens. The Department of Education leads on the development of an executive early learning and childcare strategy. The Minister of Education intends to bring forward a comprehensive and ambitious draft early learning and childcare strategy to executive colleagues for public consultation by this autumn, which will support child development, making childcare more affordable and enable parents, particularly women, to work. Pending the development of the strategy, the Education Minister secured 25 million of executive funding in May 24 to implement a package of measures this financial year. This investment is making a real difference to thousands of children, parents and families here. The Childcare Subsidy Scheme has given working parents a 15% reduction on their childcare bills. More than 14,000 have been registered and approved for the scheme, with parents collectively saving 5.4 million for September and up until mid-January. And when combined with tax-free childcare, parents have saved over 11.3 million. An additional 7.6 million has been invested in existing early years programmes like Sure Start, Pathway and some administered by other departments, such as the Department of Health's Fair Play grant scheme. This also included an allocation of over 300,000 to the Department for Communities for childminding training through the labour market partnerships. A major expansion of preschool provision will ensure that all children have access to full-time preschool education, with an additional 2,500 children getting a full-time place in September 25 and more to follow in successive years. NISRA has been commissioned to undertake a major household survey of parents' childcare requirements. This survey and the administrative data being collected from the NI Childcare Subsidy Scheme will inform the next steps. Funding has also been allocated to the Department for the Economy to carry out an in-depth assessment of the sustainability challenges faced by many childcare providers to determine what support they need and how government should respond. But of course we have so much more to do, and the prioritisation of early learning and childcare within the programme for government demonstrates the Executive's commitment to investing in this area over the longer term. I'd like to move on now to women in the economy, and I want to thank Christiana and Rachel for her statement on women in the economy, because it really highlights the importance of ensuring that there is an equitable economic playing field for women here. I believe that if we are to realise our full potential as a society, then we must do more to champion and celebrate women in the economy. We need to recognise the contribution women are making in all aspects of life. The Department for the Economy has a number of strategies aimed at addressing gender inequalities in the economy here. Providing accessible skills and education programmes is a key element of how the Department helps women become part of and remain in the labour market. Taking a holistic approach and what it provides and where has helped women start, re-enter and stay in jobs that they may otherwise have thought inaccessible. Initiatives like the Step Up programme have been providing tailored support interventions to women wanting to re-enter the world of work through its Women Returners Access programme across the 6 further education colleges. This includes regular one-to-one mentoring, travel and childcare allowances, and providing additional support to initiate a personal and learning journey towards a new future. Through the Skills Fund, a series of Women Returners initiatives has helped up to 200 women use learning to gain the confidence and skills to re-enter the workforce. Its initiatives have also provided skills and training with the potential for a work placement and access to employment opportunities. These courses are again delivered through local colleges in partnership with community-based organisations and employers, helping women gain sector-specific skills as well as transferable skills such as leadership, project management and business improvement techniques. There's also been some great work taking place to encourage more women into STEM careers. A key action in the Women in STEM Action Plan, published by the Department for the Economy, set an ambition to increase women working in STEM in the North to 30% by 2030. Encouraging girls and young women to consider studies and careers in STEM is a key part of the action plan, and work continues on this strand, encouraging links with other programmes and initiatives within skills and education. The Department for the Economy also supports the Cyber First programme, which includes a focus on increasing awareness among young women of the interesting and rewarding career opportunities in cyber security and tech. And Ulster University is delivering a programme that will specifically address barriers encountered by females within leadership roles, with a specific STEM sector focus. Increasing the number of women and girls accessing STEM will help meet the Minister for the Economy's economic priorities around increasing access to good jobs and commitments to decarbonisation. Making access to skills and education easier and more flexible is essential for the economy, but more importantly, it's vital that women feel they have appropriate options around their studies and careers in whatever occupation they choose. Addressing the gender employment gap is also key to overcoming the challenges facing women here, and key to further embedding gender equality. The backbone of good policy development comes from the consideration of good research. And Queen's University recently produced research examining key factors of the gender employment gap, reporting on areas such as the role of motherhood, the provision of informal caregiving, and the influence of gender norms and attitudes. These factors are being considered in skills and education development to provide a range of different pathways for women, given more choices and control around how they want to study, upskill, reskill and advance their skills. I would like to thank Siobhan, Natasha and Rebecca for their statements today, because when we talk about unrecognised work done by women in society, I'm sure that we will all agree that there are very few roles less recognised than that of being an unpaid carer. It has to be and it must be addressed, and I know the Department for Communities is committed to doing so. The Treasury announced in the budget that from April 25, the weekly earnings limit in carers allowance will be linked to a formula equivalent to 16 times the rate of the national living wage. This means from April 25, the weekly earnings limit will increase from its current level of £151 to £196. This significant change will enable carers to earn more money from paid work while still remaining eligible for the benefit. The Department for Communities estimates that around 2,500 carers here could benefit from the change by 2930. And the Department will bring forward legislation in March to put in place the change to the earnings limit from April 25. The Department is also looking at additional support for unpaid carers. On the 10th of February, the Assembly agreed a motion calling on the Minister for Communities to introduce a Carers Allowance Supplement Scheme as recommended by the Carer Poverty Commission NI. And I'm pleased to say that he's given a commitment to working with other departments to review the adequacy of the support that is provided across government to unpaid carers and to advocate for a more coordinated approach to considering the needs of that group. The issues of carers and unpaid work in society is hugely pressing. Ensuring that we increase recognition of the incredibly valuable work that is done by so many, and developing further strategies to support women and indeed men in this area is really important. To conclude, Mr Speaker, there have been many complex and important issues raised by members here today and other contributors. However, it's difficult to answer and respond fully to all of these themes in one session. I can assure you that the issues you've highlighted will be brought to the relevant ministers. Events such as this provide an excellent platform for celebrating and recognising the work that you all do to promote and develop the position of women across our society. Whilst as a society we've made progress, we recognise there is still significant work to be done to address gender inequality here. We're striving for a society free of inequality and discrimination, and I believe the work being taken forward across departments and by groups such as yourselves is helping us towards achieving that goal. I believe that each of us here, engaging together and engaging constructively, going forward will help us move closer to achieving true gender equality. Thank you.
Thank you. I call Junior Minister Cameron.
Thank you, Mr Speaker, and thank you for providing this opportunity today to the Women's Parliament to shine a light on issues that are critically important to women throughout society. I want to commend, first of all, the Women's Consultative Panel members for their contribution and to thank the Assembly team who have made the outreach parliaments happen. And in particular, I want to offer a massive thanks to everyone who has engaged and contributed so fully to today's event. Thank you in particular to Farah, and I want to say you're not invisible. Thank you. To Sonia, to Aisling, who made such important contributions. We do really appreciate you sharing your lived experiences and the valuable contribution that you make to daily progress the cause for women and to create gender equality for all. Farah, thank you for your statement in particular on disabled women. It's so important to hear the experiences of women across society, in particular those voices that are often marginalised or ignored. Support for people with disabilities is vitally important, particularly in relation to women with disabilities. The work of the Department for Communities is progressing around the disability strategy, and that will offer critical support for women, and that ongoing work is vitally important if we are to address all of the challenges faced by women here. Ensuring that disabled people, including disabled women, have the same rights and opportunities as the rest of our community is a key priority for the Communities Minister. The Communities Minister wrote to his executive colleagues on the 11th of October 2024 to outline the next steps in the development of the disability strategy and to confirm that he has decided to move forward on the development of the strategy, with work commencing on it immediately. Work is therefore continuing to ensure that the disability strategy reflects the current needs of people with disabilities, including disabled women, alongside the Executive's priorities. As part of this process, further engagement with stakeholders, including with representatives from the co-design group, as well as organisations who represent and include disabled women, will take place prior to its finalisation and public consultation. The disability strategy's primary aim will be to improve the lives of people living here who are deaf or disabled, including disabled women, so that they can play a full and active role in all aspects of society. A wide range of actions delivered by a range of departments will contribute to the delivery of the strategy, and we will have regard to the departmental budget allocations in terms of affordability and deliverability. Final decisions on the content and the timings of the implementation of this executive strategy will be subject to executive agreement. Mr Speaker, in terms of EVOG, which is the subject of eliminating violence against women and girls, thank you today, Sonia, for your statement. I believe your contribution highlights how important this strategy is here in Northern Ireland. Ending violence against women and girls is a key priority in the programme for government, and it is something that the Executive is very much united behind. And I'm pleased that we are making real progress with the strategic framework and the delivery plan, which was launched by ministers in September. The strategic framework to end violence against women and girls was developed following a successful co-design process which involved over 50 stakeholders, as Sonia well knows, with representatives from a wide range of sectors, including departments, statutory agencies, the voluntary community sector, and crucially those with lived experience. The strategic framework and first delivery plan have been equality screened, and the full equality impact assessment has been conducted, with no significant adverse impacts identified. As outlined in the strategic framework, the Executive Office will build on the success of the co-design approach by facilitating an insight and reference network. This will provide a strong connection with the community and voluntary sector, promote the work of partners and provide a mechanism to inject service provision, expertise and lived experience into the delivery of EVOG-related work. The framework focuses on prevention and is intended to address a full spectrum of violence, abuse and harm that women and girls disproportionately experience on a daily basis. It also sets out key actions to support collaboration across government and wider society, with a clear focus on prevention and early prevention. Last month, as part of a wider £3.2 million investment, we launched the Local Change Fund, with a total of £2 million being shared across all 11 councils to enable them to support actions in their local areas. This funding will support community networks and provide opportunities for grassroots organisations to play a key role in preventing violence, harm and abuse against women and girls. An investment under the Regional Change Fund was also announced in January, and this £1.2 million initiative will support and partner with 8 community and voluntary sector organisations who are already leading the way in preventing violence against women and girls. They will raise awareness, increase understanding of the issue, build capacity to take action and equip people to enjoy safe and healthy relationships. It is vital that we all work together to build the transformative change that we need so that women and girls can live their life free from violence, abuse and from harm. Collaboration is key, and our officials continue to engage across departments and with the Department for Justice on relevant matters, including hate crime legislation, and that's following Judge Marnon's review of hate crime legislation. All of these elements are part of a much wider strategy, and with the help of everyone here and so many individuals and organisations across society, we can help change the kind of attitudes and behaviours which harm women and girls. In terms of equality and human rights, thank you, Aisling, for your contribution to the debate on equality and human rights in the context of the Programme for Government. And one of the key principles behind the Programme for Government is the issue of well-being, including gender equality for all. This can be expressed in terms of equality and human rights, and the new PFG Wellbeing Dashboard outlines how this will be measured going forward. The Wellbeing Framework was launched alongside the consultation on the draft Programme for Government in September. The framework has 10 strategic domains of wellbeing, each of which provides a high-quality official statistic. This suite of indicators is consistent with the international approaches to wellbeing frameworks such as the UN Sustainable Development Goals and the Organisation for Economic Cooperation or Development's Better Life Index. Executive Office statisticians have had positive engagement with several leading organisations around the suitability of the approach, and we are in the process of linking commitments set out in the Programme for Government to the Wellbeing Framework, and a similar exercise is being conducted by the Department of Finance as part of the budget process. This analysis will inform future iterations of the Programme for Government and the wider work of the Executive, including the need for gender equality here in Northern Ireland. The Executive Office Assembly Committee is currently conducting an inquiry on differences in equality legislation between the regions of the UK and the Republic of Ireland. The purpose of this inquiry is to determine how equality legislation differs here compared to other jurisdictions and to understand impacts that this has. Many of you will know that the gap exists around protection against discrimination on grounds of age in access to goods, facilities and services. And we must all ensure that we pay attention to the impacts of policy decisions on older people and older women in particular. Consideration of extending age discrimination legislation to the provision of goods, facilities and services was the subject of consultations in a previous mandate. A decision was not made in respect of the scope of that legislation. This issue requires further work, and officials have undertaken a review of the current position. And Junior Minister Riley and I have also recently met with Claire Sugden, MLA, who intends to bring forward a private member's bill on this particular issue. It is also worth noting that sex discrimination, as we've heard already, is the second most reported form of discrimination to the Equality Commission each year, along with the high rates of violence against women and girls. This really does demonstrate the need to strengthen legislation to include more extensive protection from discrimination across all protected characteristics, to ensure we have a society that is fair and equitable for everyone. I know the committee began oral evidence sessions and launched a call for evidence in September, inviting people to give their views. It is considering this written and oral evidence before moving on to deliberate on a draft report to the Assembly. The Assembly has received submissions and oral testimony from many women's rights groups here, highlighting their concerns over gaps in legislation. The committee's inquiry is ongoing and is expected to publish a report on its findings and recommendations soon. Once this report has been published, ministers will consider the findings, and this may include consideration of the need to review the effectiveness of Section 75. With regard to the implementation of the Identity and Language Act, Northern Ireland in 2022, the appointment of language commissioners and director and members of the Office of Identity and Cultural Expression is essential to implement the provisions of the Identity and Language Northern Ireland Act 2022, for which the Executive Office is responsible. The First and Deputy First Minister are committed to establishing 3 new bodies, and preparations are now at an advanced stage. Ministers have committed to following the principles of the Commissioner for Public Appointments Code of Practice for these appointments. So we need to work together as a society to also eliminate racism here in Northern Ireland. And the Racial Equality Strategy, which is from 2015 to 2025, established a framework for action by the Executive to tackle associated issues, which included racial inequalities, racism and hate crime, actions to promote good relations and social cohesion. On the proposed actions in the strategy, the majority of actions have been completed, with the remaining intended to continue throughout the lifetime of the strategy. Whilst it remains a key priority to continue the full delivery of commitments in the current strategy, it is important that post-2025 there is a clear mechanism of overarching framework for promoting racial equality in our society. Officials have already begun engagement with the minority ethnic sector to support the development of a new strategic approach to racial equality post-2025 in a visioning workshop in September in 2024 with the Racial Equality Subgroup and the Travellers and Roma thematic groups. A public call for views was launched on the 6th of February to support the development of the new approach to racial equality, and we want to hear from key stakeholders, the minority ethnic sector and wider society. We hope the consultation will foster a true sense of involvement and responsibility for everyone when it comes to addressing racism and racial equality. So I'd like to conclude by once again thanking all of you for your valuable input today. And in particular, again, I want to thank Farah, Sonia, Aisling for your contributions. It has been fantastic to hear, though, through strong female voices, the issues that affect women here in Northern Ireland. Alongside Junior Minister Riley, I also hope that we have been able to outline some of the Executive Office and executive strategies contained in the programme for government that exists to address ongoing challenges facing women here. As you have heard, the draft programme for government exists as a commitment from the Executive to focus on improved wellbeing for everyone. Of the programme's 9 priority areas, some relate directly to the issues we face as women, such as ending violence against women and girls and delivering more affordable, accessible and high-quality early learning and childcare. But I believe that every single one of the priority areas can have a positive effect on women. As has been mentioned, we recognise that the discussions we have had here today are not the end of the invaluable work that the Women's Parliament does. We know there is much still to do, and we look forward to engaging with you all in the future. So I want to finish by taking a moment to thank and celebrate each one of you here today. I want to celebrate the positive contribution you make in our society. Your talent, your tenacity, your achievements, your ability to shatter glass ceilings, and the fact that you are an inspiration, not only to those around you, but those following in your footsteps. There is still work to be done to embed gender equality here, we know that. But I want to acknowledge how far we have come and where we are now, thanks to the positive role so many amazing women play here. The kind of positive role that you play, and no doubt will continue to play in the days, weeks and months ahead. So, Mr Speaker, just in closing, can I take this opportunity to congratulate yet again each and every woman for the really important contributions made here today. As a woman, as a mother, a wife, sometimes a carer, and as a politician, I know only too well how challenging it is juggling all that we do juggle every day in life just to get through this life. So I want to thank you all for raising your voice and for doing that for others. You have all been heard today, so thank you. Thank you, Mr Speaker.
Thank you, Pam, and thank you to all 20 ladies who have spoken today and raised really important issues. I think the time constraint perhaps didn't allow us to get into the depth of some of the subjects that we really could do with, and strikes me the domestic violence issue, for example, and the 25 women's deaths is something that should strike home to all of us about more needing to be done. The crisis in perinatal care, for example, is another issue which is hugely important, and we really need to move on with that. And other important issues that we didn't get to today, such as the care of women with endometriosis, or indeed the red flag cancer cases, where there are so many of both sexes, but particularly women with breast cancer and cervical cancer, who have red flags and who aren't being seen in time. And that really, really needs to be addressed. It's just not good enough, and that really needs to be addressed. But thank you so much for coming this afternoon and expressing your views so succinctly and eruditely. I know that today's debate won't be the end of you making your voices heard, and I hope you enjoyed the opportunity to do so in this chamber. Thanks again to all the participants. The Youth Assembly folks were here. They've moved on, I think, most of them, but we thank them for their attendance. And also to the Women's Parliament panel, who I know worked tirelessly to make this happen today, and that's why it's been such an excellent event. Also, thank you to the Executive Ministers, to Andrew and Mike, and to Aisling and Pam for giving of their time today. So that brings my remarks to a conclusion. All we have to do at this point is to formally close our proceedings in the normal way. So the question is that the Women's Parliament do now adjourn. This meeting is now adjourned.